Hello everyone, my name is Alicia and I'm working as a registered nurse in Ireland. Today I'm going to talk about nursing interviews in Ireland. So if you're new to my channel, make sure you go to the description of this video and watch that video which I've uploaded before this video about nursing interview in Ireland. Because whenever your employer from Ireland takes your interview, they start with some commonly asked questions and they usually start with some warm-up questions. So I've already uploaded a video about commonly asked questions, so make sure you watch that video before you watch this video, and then you can watch this video if you are specialized in ICU or theater. So this video is specially dedicated to the nurses who are working in ICU or theater. As I said, I have already discussed commonly asked question in my previous video, so I'm not going to discuss commonly asked questions here. And in that same video, I have discussed question and answer being asked from ward nurse, because I'm a ward nurse, so I focused on answer as well. But for theater and ICU, I believe you might be the best person to say your own answers because you might be knowing better than me. So here I'm only going to discuss questions with you because I spoke to my colleagues, two or three of my colleagues who are already working in Ireland, and then I picked up some commonly asked questions. So I'm not going to discuss answer of these questions because you might be knowing better than me. So you can give your best answer to them, but definitely I've picked up most commonly questions. So hope this video will be helpful for you. So without further ado, let's begin. First, I'm going to start with ICU. So for ICU, tracheostomy care, and when I say tracheostomy care, so each and everything about tracheostomy care, nursing responsibility while taking care of tracheostomy. And they asked one of my colleagues, if while doing suction you find out that tracheostomy tube is blocked, what will be your immediate nursing action? So when I say tracheostomy, each and everything about tracheostomy. So they can ask anything about tracheostomy or tracheostomy care. So make sure you are thorough with tracheostomy. Another thing, ECGs. So make sure you are familiar with all abnormal waves, and you should be able to describe abnormal waves. How do they look like? Because they asked one of my colleagues to describe one of the ECG rhythm and what treatment they are going to treat. And they can also ask you in which ECG rhythm you will cardiovert the patient and in which you would not be cardioverting the patient. So make sure you are familiar with all ECGs, normal and abnormal rhythm, and just touch the baseline that which ECG rhythm requires what kind of treatment. So you should be familiar with all ECGs rhythm. Another important question is intubation. So they can ask you about intubation tray, articles kept in intubation tray, nursing responsibility while doing intubation, and nursing care of a patient after intubation. So make sure you give them your best answer, and make sure to mention each and everything when you are saying articles of intubation tray, and even small things matter. So make sure you mention each and everything. Usually when they are interviewing an ICU nurse, they will give you a particular scenario about critical illness, like care of patient on ventilator, care of patient with bleeding, care of patient with sepsis, and care of a dying patient. So they will not ask you a direct question that what would be the care of a patient with sepsis. So they can give you a particular scenario, and then you have to say that this patient can have sepsis. So they will never ever ask you care of a patient, care of a dying patient. They can ask you that a patient is for a palliative care and he or she have so and so things. So you can say that patient is for palliative care. So what you gonna do, what will be your nursing care, and that patient is critically ill. So how you gonna deal with that? Other important thing for ICU nurse is an ABG. So just make sure you should be aware of normal values of arterial blood gas analysis, and you should know how to interpret the value of ABGs. Other thing which I found out while asking my friends is they're asking most of the nurses. They did not ask me, I don't know why, but they asked most of the nurses about JCI. What is JCI and why it's mandatory for all hospitals to apply for JCI, and what are the criteria of JCI. So even if your hospital is not JCI and you're not working in JCI hospital, just make sure you read a little bit about JCI. Other thing which they're asking ICU nurses is about MDT. So why MDT is important for ICU patients or critically ill patient? Who all are the members of MDT? And what do you think, like how MDT affects patient care? So you can give your best answer as an ICU nurse. What do you think about MDT and why do you think that MDT affects patient care? Let's start with theater nurses. So even for theater nurses, they will start with some warm-up questions or commonly asked questions. So make sure you watch that video first, which I've already uploaded, and link of that video in the description there. So after that, they will ask questions related to theater. So most commonly asked questions from theater nurses are swab counts and how do you perform swab count, why swab count is important, and how you start your day in theater. So you can just say your routine, your schedule, and your roles and responsibilities, and then nursing quality indicators. Other thing is time out in surgery and who performed time out in surgery. And they can also ask about JCI, as I already said. Apart from that, they ask about how will you check patient in pre-op area and why pre-op check is important. So when they're asking this question, they can also ask about checklist and what all things you check in your checklist while you're receiving a handover from nurse or while you're receiving a patient for surgery. Other thing is site marking. So they can ask you about site marking, why site marking is important, and who performs site marking. So if in your hospital it is done by anesthetic nurse or a surgeon, so theater nurses, you know better. So you can say in my present hospital it is done by a surgeon or anesthetic nurse or whatsoever. Other than that, they can ask you about your role, if you're working as a floor nurse or whether you're working as a scrub nurse. So whatever it is, if you're working as a floor and scrub both, so you can answer, I'm working as a floor and scrub both. So as a floor nurse, my responsibility is this, and as a scrub nurse, my responsibility is this. So you can just answer your responsibility, you can just separate your roles and then you can say your responsibility, so it would be more clear to them. Also, they can ask you about specialization. So if you're specialized in gastro, ortho, neuro, ENT or gynae, so they will ask you about your specialization and then they will ask questions from that particular specialization. For an example, they can ask about various surgery from that particular specialization. Apart from all these questions, disinfection is also one of the most commonly asked questions from theater nurses. So they can ask about disinfection of instruments after surgery and disinfection of theater room after surgery. So as per your hospital policy, you can answer this question that in my hospital we do disinfection like this, or we disinfect instrument like this. So that's all about ICU and theater nurses. If you find this video helpful, make sure you hit the like button and subscribe to my channel. It will just take 1 minute for you, but for me, it will give me encouragement to make more contents like this. Until next time, bye bye. Take care of yourself and your family and all the very best for your interview.